When people asked me if I was ever worried about the abortions that I had done, I said, no, the only ones that ever haunt me are the ones I didn't do. That it was lousy medicine that we were practicing by not taking care of these women, by insisting that they carry their pregnancies.
I'm Lisa Berry Drago, and this is Distillations. This is a special bonus episode all about Jane Hodgson, an American obstetrician and prominent abortion rights activist. In 1970, 3 years before Roe v. Wade, Jane Hodgson became the only doctor to ever be convicted of performing an abortion in a hospital in the United States. We shared just a bit of her story in our last episode, Roe v. Wade v. Rubella, but there's more to tell. So if you haven't already heard it, you might want to go back and listen to the last episode first. It'll help you put the story in context. Before 1973, abortion was illegal in this country, but each state had exceptions for medically necessary or so-called therapeutic abortions. In Illinois, the exception was vague. There just had to be a bona fide medical reason. But other states, like Arizona, Texas, and Minnesota, only permitted medical abortions if the woman was going to die. Over the course of her career, Jane Hodgson went from agreeing with strict abortion laws like Minnesota's to believing that all women should have access to safe and legal abortion. Eventually, she risked her career to try and change the law. Jane Hodgson passed away in 2006. The following excerpts are from an oral history conducted by Columbia University in 2000. Sociologist Carol Jaffe wrote about Jane Hodgson in her book, Doctors of Conscience, The Struggle to Provide Abortion Before and After Roe v. Wade.
Jane Hodgson was born in 1915 in Minnesota. Her father was a doctor. She went on house calls with him. She determined to become a doctor. There was not that many women born in 1915 who became physicians, but she did. She became a very successful OBGYN in the Twin Cities.
Jane Hodgson opened her private practice in Minnesota in 1947. Despite years of training and expertise, her medical education had left her unprepared for all the patients who would come to her over the years seeking abortion.
Being a woman doctor in those days meant you had a lot of women coming to you desperate to get an abortion, and she kept refusing them. She did not want to lose her license. She had not been taught about abortion in medical school.
It wasn't even discussed. It was just a sacred thing. It was a medical maxim that you never, ever invade a pregnant uterus.
While working in a hospital and medical school, Jane saw countless women suffering from botched abortions. She treated them as she would have any other patient, but the state of Minnesota treated them as criminals.
I remember being struck by the policeman standing outside the door of the rooms, because in Minnesota's abortion law was very rigid. It was the strictest probably in the country. Both the patient and the doctor were liable, up to 2 years in prison. And the patient just was as guilty as the doctor. Sometimes the police would interrogate the doctor to try to get the information as to where she'd had her abortion or who had done it and all the details. They'd usually want to get all the medical history. They were interfering because they were supposed to bring charges against the patient as well as the doctor. And that struck me. I'll never forget that.
Despite the law, women kept asking her for abortions.
In St. Paul, I was besieged by women who wanted pregnancies interrupted. I would warn them about an illegal abortion. I could do nothing about it, but you know very well that some of them were going to ignore you and they'd be back. And then sure enough, they'd be back in my office in a few days and they'd be bleeding. And I would have to take care of them.
I mean, she would refuse women, and then she would tremble looking at the local papers. She would tremble, will I find out that they killed themselves?
One of the first patients that I saw there was a young woman who had gone through a series of pelvic infections, I'm sure following an abortion. And although I don't think I ever remember getting the details of the history from her, it was a tragedy. We all knew that this young woman was going to die eventually because she was just getting worse and worse and worse.
Jane Hodgson saw countless cases like this, but she felt powerless. The law was clear, but the results of illegal abortions were devastating.
You think, now I could have prevented this. She came to me when she was well. And if I could have solved this problem, and she would have been spared all this. When people asked me if I was ever worried about the abortions that I had done, I said, no, the only ones that ever haunt me are the ones I didn't do. I said and was quoted as saying that it was lousy medicine that we were practicing by not taking care of these women, by insisting that they carry their pregnancies.
In later years, Jane would sometimes suggest to her wealthier patients that they travel to other countries where abortion was legal. But she still couldn't help women without the means to travel. And that was frustrating. So finally, she decided to do something. Rather than break the law and perform abortions quietly, like plenty of other doctors did, Jane Hodgson decided to break the law openly in order to challenge it.
She said, I had been taught abortion was immoral. And at a certain point, I realized the law is immoral.
So she started looking for a test case to challenge the law.
She very much wanted to become the test case that would lead that ultimately became Roe. Her case didn't, but she very thoughtfully found what she thought was the, quote, perfect candidate.
So I'd been looking subconsciously, for a case for a long time, and I thought this should be a married woman, and she should have already proved her be maternal and have 2 or 3 kids. They'll like that better. She'll be more of an ideal case. And there's got to be a good medical reason. And I was just sort of looking for one. And she walked into my office the very next day.
Nancy Widmeyer was married with 2 children and pregnant with her 3rd. And she had rubella.
She could have afforded to have gone to Mexico or to Canada, and I made those suggestions to her. And she said, no, but I want you to do it. She said, and I don't want to leave my children. And she said, I don't think I should have to. And I got thinking, well, no, I don't think you should have to leave either.
After Jane Hodgson got support from 7 of her fellow doctors, she gave Nancy Widmeyer an abortion. It was 1970.
She did the abortion from the operating suite. She called the local DA and said, I want you to know I did an abortion.
A few days later, a policeman came to her office.
He was perfectly polite, but told me firmly but politely that he would like me to come down to the police station. It would be necessary for me. I always abided by the law. I hadn't even been arrested for had any driving arrests or parking tickets or anything like that. No, it was really my first encounter with the law.
Jane was tried and convicted. Her sentence was stayed, but her medical license was suspended. She appealed, and the case dragged on for years. It never made it to the Supreme Court, but another test case did, and the Minnesota Supreme Court was waiting to see how the U.S. Supreme Court would rule.
While she was waiting for the appeal to be decided one way or another, by now Washington, D.C. had legalized abortion. Both Washington, D.C. and New York had a legalized abortion before Roe in 1970. She went to D.C. She was the medical director of one of the first freestanding clinics, preterm. She pioneered a lot of the early abortion research on what it's like to give abortions to a large group of healthy women. Because remember, till now, it was mainly very sick women who were getting abortions.
Jane Hodgson's work would show that complication rates were actually remarkably low. It was contrary to everything she'd been taught. Jane Hodgson was still in D.C. in 1973 when the Supreme Court made its landmark decision in Roe v. Wade. Her conviction was eventually overruled, but she didn't stop fighting for abortion access.
Into her 80s, she would fly from the Twin Cities to Duluth, Minnesota. She helped set up a clinic there, but no local doctor would agree to work there because they were afraid of the repercussions. They would lose patients, they would be blackballed from their hospital. The thing they feared most was protesters showing up at their house or their kids' schools, things which have happened over the years to abortion providers. Jane Hodgson sued the state of Minnesota repeatedly. After Roe, her local hospital refused to set up an abortion clinic. She sued, ultimately won. She was the lead plaintiff in a lawsuit about parental notification in Minnesota. So she really switched her life around from being this highly respectable doctor who got awards from Republicans. She became, in some circles, a pariah. I mean, for me as a sociologist, the take-home from thinking about her life and her career was really noting the price that one paid.
Thanks for listening to this bonus episode of Distillations. It was reported, produced, and mixed by Mariel Carr. For Distillations, I'm Lisa Berry Drago.